Eyewitness News, more medical coverage now. There's a walk this weekend to help cure arthritis. Joining us now, Dr. Patricia Soscia from the Lifespan Physicians Group. Good morning to you.
Good morning. Thank you for having me.
Yeah, thanks for coming in. Let's talk about the month in general, and then we'll talk about more specific stuff that's coming up. But this is Arthritis Awareness Month?
It sure is, and thank you for allowing me to speak about it.
Yeah.
But arthritis is a common problem. It's the leading cause of disability in this country. 53 million people with doctor-diagnosed arthritis, so probably a whole lot more people out there with arthritis that don't even see a doctor. So we're trying to raise awareness to get people to treatment early. And of course, rheumatoid arthritis, which we were hoping to talk a little bit about, is an incredibly common disease, and it affects a whole lot of people, including children. About 1,000 children in the state of Rhode Island with a juvenile idiopathic arthritis or an autoimmune type of arthritis. And we're trying to raise awareness because whether you're 7, 20, or 70, you know, it has a great impact on people's lives.
I want to ask you about distinguishing between arthritis and other types of joint pain.
Sure.
Because I'll be honest with you, my hands, when I wake up in the morning, they hurt.
They hurt.
It takes a little while. It's like the
few minutes of morning stiffness.
The Tin Man and the Wizard of Oz. You need a little oil in there to grease them up. But what is that? Is that arthritis, or could that just be joint pain?
No, that can be early arthritis. It can be early arthritis for sure. So there are over 100 different types of arthritis, and so they can be tricky to diagnose, and sometimes it takes some time to actually make a correct diagnosis. But rheumatoid arthritis is an autoimmune, not a low immune, but an autoimmune type of arthritis where the body reacts against itself in ways it shouldn't, and it can actually cause a lot of damage and inflammation to the joints. But most forms of arthritis will involve stiffness, especially in the morning when you first wake up, and then you loosen up a little bit as the day goes on, swelling, and of course pain and limitation. And again, it does not discriminate. While rheumatoid is more common in women, and has certain blood work and other features where we can distinguish it through a series of examinations and laboratory testing and x-ray, we can distinguish the different types of arthritis because they have very different treatment.
I want to ask you about that. We have 30 seconds. What are the best types of treatment initially?
Well, first of all, early treatment and early diagnosis is key because, and depending on the severity of your disease, early treatment with medication can prevent damage. And our goals are twofold: get people comfortable, get people moving, exercising, eating healthy, of course, but more importantly, if necessary, getting them on the right medications to slow down or stop the damage from arthritis, and that's the key.
All right, yes or no answer. Does cracking my knuckles create arthritis?
It does not create arthritis, but I would be gentle on your knuckles yet.
Bad habit. Thanks so much for coming in, Doctor.
Thank you so much.
If you want to see more of this topic discussed, go to our website. You can find more about the walk as well. Go to WPRI.com.